Kaci Groves, and today I will be showing you how to do post-mortem care of the body for the HOSA clinical nursing competition. First, you'll need to check your physician's orders to make sure you have the right patient and you're doing the correct thing for that patient. Next, I will assemble all my supplies. My supplies are behind me right here. I will wash my hands and put on 2 pairs of gloves, which I have already done beforehand. Next, I will put on a protective gown. Next, I will locate 2 identifiers of this patient. Her eye color is one, and then her hair color is the other one. And those are both the same as what the physician's orders say. Next, I will straighten the body and place a small pillow under her head. Well, the body is mostly straight, so that part's done. And then I'll grab my small pillow. I will gently lift up her head, and I will place it under her head. If her eyes were to be donated, I would close them and place 2 small ice packs on them. But since they are not, I will just close them and not put the ice on them. At this time, I will remove any jewelry on the patient. Okay. Then I will place this in the items bag. Next, I'm going to use my rolled towel and place it gently under her chin to close her mouth. At this time, I would remove any intravenous lines that were still on or monitors unless instructed not to. And then I will remove any of the linens that are covering her, except for the sheet that is on top. Then I would bathe any part of her body that has been soiled with discharge. Next, I will place the pad under her. So I will lift up the sheet, and I'll roll her over. I'll place the pad underneath her, and roll her back over, and then cover her back up. After I do that, I will remove any of the dressings on her body that need to be changed or cleaned. So she seems to have a wound on her arm, so I would remove this dressing. Since it was still producing, I would put another one on. Now it is time to pad her wrists and ankles. So I will get my gauze pad. I'll take it like this and just place it on her wrist and put tape as me. And I will do the same thing with her other wrists and her ankles. I will now, if she had any glasses or dentures, this is when I would remove them and label them for the funeral home. Now it is time to use our identification tags. One goes on her wrist. Oh, there you go. Just like this. And the other one goes on her right big toe, or also known as her right great toe. Now at this time I would grab a zippered bag and attach an identification tag to that. And then I would place her in the bag and zip it up. And if she has any known diseases, you should note that on the bag. Lastly, I will properly take my gloves off, like so, and dispose of them. I will also dispose of my gown and use alcohol-based hand rubber hand sanitizer